So why don't we go ahead and start, colleagues? We're now going into the final segment where we'll try to identify lessons learned moving forward. The focus, I think, where we all want to end up is improving the outcomes in communities. That's why we're doing all this. Afaf is going to be giving a presentation. I thought it might be useful. I think everybody knows Afaf, Meleis, and everybody knows that she's the dean of the School of Nursing at Pennsylvania and has a long pedigree. And I think all of us understand that she has both wisdom and passion in this area. But I asked her, and I think we need to honor that in our group, but I also asked her, what got you interested in this to begin with? Why did you get interested in interprofessional education? And she said, well, while there are many routes, I'm sure, one of the experiences was being invited to go to the University of Linköping in Sweden and to help put together a new discipline, the caring sciences, that got her really to understand the potential and the excitement of a new way of thinking about care. So I think we need to appreciate her as well as Jordy Cohen's leadership of the forum as it's matured over the last couple of years. So thank you very much.
Thank you, Dr. Newton. And since I am not going to be at the podium at the end of this workshop, I'd like to take this opportunity to thank the co-chairs of this absolutely fantastic workshop, Dr. Newton and Dr. Susan Scrimshaw. I think what I'm hearing everywhere is that this has been really impactful, lots of engagement of people, and lots of substance. So let's give them a round of applause for what they have done. So for this, there are 3 segments to what I'm going to be doing. I'll just give a few minutes of what outcomes we look for and broaden our view of what outcomes we might want to think about for community-based involvement. Then we're going to see, I'm going to introduce a star who really knows what outcomes she was looking for and made those outcomes happen. We're gonna have a video of her, and then she gets to speak and answer some questions. So, you know, outcomes and effect of community-based comes in many forms. I think we have been focusing on practice and what we are doing on practice, but it also come in the form, we've been focused more on education, but outcomes also come in the form of research that we produce, knowledge. We represent institutions here that produce knowledge, and also come in the form of effect on practice, and that's what Dr. Lubeck definitely will speak about. So I want to give just 2 examples. One from UCSF, University of California, San Francisco, where I worked for 34 years before I became Easterner. I'm a foreign comer from California to the East Coast, which is a completely different culture. And I'll give the other example from University of Pennsylvania, from Philadelphia. So in the 70s, we were beginning to realize that we were not providing culturally competent care. We can't talk about community-based without thinking about culture. We realized we were not giving culturally competent care to immigrants who are coming from different parts of the world. So one such group were the Middle Eastern group in California. So we're talking about the 70s. Because I was born in Egypt, and because I went during my time here for a couple of years to Kuwait to establish schools, I became an instant consultant for all healthcare professionals who are taking of Middle Eastern immigrants, just because of those 2 facts. And I realized that this is a group that has not been identified as a group that needing special kind of care and culturally competent care. And I also realized there was really no knowledge that has been developed about that group. So we developed an office, and we called it the SIHA office, Study of Immigrants, Health and Adjustment, SIHA. SIHA in the Middle East, in Arabic, and in Farsi means health. So again, we became instant celebrities in the community because they said, we want to go to the Saha office to provide care there. We invited students to participate, we invited faculty to participate, and we developed a framework for culturally competent care. And so one of the outcomes that came from that is, first of all, that this group became defined as a minority group, and there were no funds for them, there were no interpretation for them in the healthcare system. So one outcomes that came from our developing the SAHA project, involving the students and involving the faculty, was to define them as such, and there were some funds. Policy, here is where policy came in. Some funds were allocated by the mayor's office and then by the governor's office for care for that population. So that's one outcome that was really important for us to think about. Another outcome, it became sustainable, the care for them. What we did was simply act as a referral office, as a health assessment office, as an advocate office, and to help them navigate into the healthcare system. So another outcome was that we didn't have knowledge related to that. So the students who did all that work, our entree to the community is actually by providing care. There were lots of research that was going on. Pain management, activities, the ways by which the behaviors, how they reacted in the society, their exercise program, hypertension, and so forth. So a lot of research came out. Actually, 33 dissertations came out from our involvement in the community. So another outcome is that we did put in the literature a great deal of knowledge about that population, and that really evolved from there into many other research projects that came out of that. So that's one example. The second example is in Philadelphia. West Philadelphia, we are an aging population, and we needed to do something about the elderly to keep them at home as long as possible because they don't want to be institutionalized, and they also, it's also costly to get them institutionalized. So what did we do? We developed a program in West Philadelphia, called it LIFE, based on the PACE program from California, which was taking care of Chinese immigrants there. So again, the product of dealing with immigrants. So the LIFE program in Pennsylvania, in Philadelphia, is owned by the School of Nursing. We are the only school of nursing in the country who owns a practice. We run a practice, and we take care of 430 elderly people in West Philadelphia, keeping them at home as long as possible. We provide all the care for them. We own 22 microbuses that bring them in the morning to the center. We take care of all their health care. We take care of all their nutritional needs, their cognitive needs, and we send them home at the end of the day. So what's the outcome there? There are 400 students who get trained there that are multidisciplinary. There are, at any time, there are 10 research projects that are going there. We translate the faculty research into practice. So the faculty research that gets published in the New England Journal of Medicine and in nursing research doesn't sit on shelves. It gets translated out in the community. And the multidisciplinarity is just absolutely, the interprofessional work is absolutely magnificent there. We have students from Wharton, we have faculty from dentistry, we have them from medicine, we have from social policy. So here is another outcome. It's really the education that comes from providing care in the community, and the community loves us. The community loves the University of Pennsylvania and feel we are doing something for them. So these are some of the things that we need to be thinking about in terms of outcomes and broaden, what we want to focus on in outcomes. Improving women's health is an outcome that Dr. Lubeck has done. There are 800 women who die every day from preventable, because of lack of access to health care. There are, every 90 seconds, one woman dies in labor. Just think about that, all over the world. We are not immune in this country. When I give figures like that, people think it's somewhere in Africa or in Southeast Asia. But we all have our pockets here of developing country. And that's where Dr. Lubeck, a nurse, midwife, educator, administrator, crusader, advocate, and I'm going to go on and on, Dr. Lubeck. So sit there and be comfortable while I talk about you. And, you're supposed to have only a third of that time, Dr. Lubeck. This is really to honor her and honor her practice. Her decades of work transformed the way American women gave birth. Throughout her entire career, she worked tirelessly to find ways to help low-income pregnant women connect to the prenatal care that they often do not and cannot receive here. She has had tremendous impact on that. In 1983, she co-founded the National Association of Childbearing Centers. From here, Dr. Lubeck ignited a movement and established more than 200 freestanding birth centers across the nation and the world, serving families at all social and economic levels. In '93, she received the MacArthur Genius Award. She used the grant she received from this award to launch the DC Developing Family Center in 2000, which is the one that she's going to talk about. The center includes health and birth center staffed with midwives and nurse practitioners. She received her degree. I'm very proud to say that she received her nursing degree from University of Pennsylvania, and she worked there as a hospital nurse. Well, we won't say that. She did get only a diploma. But she is our pride and joy at the University of Pennsylvania. And I just want to say there are 2 nurses who ever received the MacArthur Award, and they both are from the University of Pennsylvania. Ruth is also, I'm sorry? Ruth is also a member of the Infant Mortality Commission. She received many awards. I won't mention all of them, but she received the Rockefeller Public Service Award from Princeton University, the American Public Health Association Martha May Elliott Award, and the Institute of Medicine highest award, Leinhardt Award. And she is the only nurse from this Institute of Medicine who received that.